Hi everyone, I'm Dr. Arsha from the Brooke Surgery, and today's live video, as voted by yourselves, is going to cover anxiety. So let's talk about anxiety. What is anxiety? So anxiety is a feeling of unease, such as worry or fear, that can be mild or severe. And everyone has feelings of anxiety at some point in their life. For example, you may feel worried or anxious about sitting an exam, taking a driving test, or even having a medical test. During this time, feeling anxious can be perfectly normal. But some people find it hard to control their worries. Their feeling of anxiety is more constant and can often affect their daily lives. Now, anxiety is the main symptom of several conditions, such as phobias, such as agoraphobia, which is having fear of being in unsafe situations, which you may feel going outside is unsafe, or claustrophobia, fear of being in tight spaces, post-traumatic stress disorder, which have a number of causes, and things like social anxiety. Now, today we're going to be talking about general anxiety disorder, and you're more than welcome to ask us questions as we go along, and we'll endeavour to answer them during the live video, or if not, if we can't answer it during the live video, then we will aim to answer them after the video. So, generalized anxiety disorder. This is a long-term condition that causes you to feel anxious about a wide range of situations and issues rather than one specific event, like we mentioned before. Now, people with generalized anxiety disorder feel anxious most days and often struggle to remember the last time they actually felt relaxed. As soon as one anxious thought is resolved, another one may appear about a different issue. So, who is affected by generalized anxiety? Now, anxiety is actually a very common condition, something we consult patients about daily, and it can affect up to 1 in 20 people. Now, slightly more women are affected than men, and the condition is common in people from ages 35 to about 59, but it's not exclusive to this age group. So, what causes generalized anxiety? The exact cause is not fully understood, although it's likely a combination of several factors. Now, some of the researchers have suggested that the factors may include some of the following things. So, overactivity in the brain that are involved with areas such as emotions and behavior, an imbalance of brain chemicals, which are involved in the control and kind of balance of your mood. The genes you inherit from your parents. So, for example, you're estimated to be 5 times more likely to develop generalized anxiety disorder if you have a close relative with the condition. Another factor is having a history of stressful or traumatic experience, such as child abuse, domestic violence, even things like bullying. Having a painful long-term health condition can actually affect you having generalized anxiety disorder, things such as arthritis. And even having a history of drug or alcohol misuse can lead to this as well. Now, unfortunately, many people who actually have generalized anxiety disorder develop it for no apparent reason, which can be incredibly frustrating. So, what are some of the symptoms of generalized anxiety disorder? So, it's worth noting that it can affect you mentally and physically. Now, how severe the symptoms varies from person to person and can affect you differently in different times of your life. Some people may only have 1 or 2 symptoms that I'm going to mention shortly, and whilst others have many more. Now, as mentioned, it can affect you physically and mentally. Anxiety can cause a change in your behavior and the way you think and feel about things. And this can lead to symptoms like restlessness, unable to sit still, a sense of dread, feeling constantly on edge, difficulty concentrating, and being very irritable. Your symptoms may cause you to withdraw from social contact, for example, seeing friends and family, so that you can avoid this feeling of worry and dread. Now, with some people, you might actually find it hard and difficult to actually go into work, and you may take time off sick. And this process can actually make you feel even more anxious, as it can cause effect in your self-esteem and cause a lack of self-esteem. So there's some of the mental kind of symptoms you can get, and physical symptoms that you can get from anxiety. There's a whole host of them. So dizziness is one, tiredness. You can get palpitations, so that's the feeling of your heart racing. You can shake and tremble. You can have a dry mouth. You can have excessive sweating, get short of breath. You can even get stomach aches or change in your bowel, which sometimes can be linked with things like IBS. You can feel sick as well along with that. Now, other symptoms you can get are things like headaches. You can even get some pins and needles. And one of the big symptoms that often causes a lot of distress is difficulty falling or staying asleep. So as you can see, there's a whole host of symptoms that anxiety can cause. Now, Some people know what triggers their anxiety. It can be an event at work or at home or an issue that's occurred, but it may not always be clear what you're feeling anxious about, especially when you have a generalized anxiety disorder. Not knowing what triggers your anxiety can sometimes intensify your symptoms because it's very hard for the brain to understand why it's feeling anxious. And then you may start to worry that there's no solution. So generalized anxiety can be quite difficult in diagnose, but in some cases, it's difficult to distinguish from other mental health conditions such as depression. And often you can even have both diagnoses together. You can have depression with anxiety. You may have generalized anxiety, particularly if you have worrying, if the worrying significantly affects your daily life. So, if you're worrying about your health, your job, your social life, if your worry is extremely stressful and upsetting, if you worry about all sorts of things and tendency to think the worst of a scenario, such as about your health. If you feel like your worrying is uncontrollable, or if you felt like you've worried pretty much nearly every day for the last 6 months. A combination of these symptoms, one or more, can often lead us to the diagnosis of generalized anxiety. Now, if you feel like you have had any of the symptoms that I've mentioned above, please contact your GP. If you're for the patient of the Brooke surgery, we have a new online system here. Simply fill in a request and we'll get back to you the same day in working hours. You don't need to phone up or queue, and you can get a response from the GP that you request. For patients that are not with the Brooke surgery, we are welcoming new patients, even outside of Hyde. If you do want to sign up and switch to our surgery, if you go to our website, www.brookesurgery.co.uk, and click on the new patient sign up button, and we can get you registered within 24 working hours. So we talked about what anxiety is, how it affects us, who it affects, what the symptoms are, and I think it's worthwhile touching upon how we can actually treat anxiety as well. So, as I mentioned, generalized anxiety is a long-term condition, but a number of different treatments can help. So if you have other problems alongside anxiety, such as depression, or if you have an issue with things like alcohol, you may need to have these particular problems treated, as they can contribute towards your anxiety. Now, when it comes to managing anxiety, there are a number of things that you can do for yourself and ways that actually GPs can help as well. In today's video, I'm going to cover what the GPs can do. And I want to do a specific video next week, which is going to talk about some self-help measures, which I'm often tell a lot of my patients about, which have proven to be very, very helpful. And many patients have been able to manage their anxiety through self-help measures they've done at home without having to consult anyone. So we will talk about that as well. So if you've ever been diagnosed with general anxiety, you usually be advised to try some psychological treatment before you are prescribed medication. You can get psychological therapies such as cognitive behavioral therapy on the NHS, and you can actually refer yourself directly without speaking to a GP. If you would like, we can provide some information about this during this live video, or I can cover this in my next self-help video too. Now, let's talk about CBT. So it's one of the most effective treatments for generalized anxiety. Studies have shown that treatments of CBT can last longer than such as treatments just with medication. But no single treatment works for everyone. So it's worthwhile having a consultation to find out what a tailored plan would look like for you. What CBT is it allows you to help question your negative or anxious thoughts, and such a thing that you'd usually avoid that make you anxious. And it usually involves meeting a highly qualified therapist for either an hour session every week for about 3 or 4 months. Sometimes the times can differ depending on where you get referred. If the psychological treatments haven't helped, or you prefer not to try them, then usually you're offered medication along with some self-help measures. Some medications are designed to be used on a short-term basis, such as if you have a particular event coming up, like a driving test or a court case that's causing particular stress, and it's not likely to cause stress afterwards, whilst other medications are prescribed for longer periods. And depending on your symptoms, you may need medicine to treat your physical symptoms. Like I mentioned, getting the palpitations and the sweating, there are medications that can help reduce that particular symptom. And some medications are to help treat the psychological symptoms too. So if you're getting to the point where you would like help with your anxiety, you want to discuss this further with some of our qualified staff, then please go ahead and get in touch with us for our patients. That's simply going on our website and using our online system, and we will get back to you the same day within working hours. And those who aren't at the Brooke surgery, you can sign up and switch to us, and we will get you registered and we can talk about your anxiety in detail. Now, I hope this video has been useful for you. If it has, please like and share it with friends that you might find who might find it beneficial. I will cover in detail some of the self-help measures that can help next week, as I think it warrants a dedicated session on that. And this is something that I've been working on a lot of my patients with, and it's been very beneficial. So take a few moments to take some questions, and I can see a couple come through. So first question here is anxiety always a bad thing? So a good question, really. I mean, overall anxiety can be tough to deal with. Our goal is never to get rid of all of the anxiety. We all benefit from some moderate levels of anxiety. So for example, if you have an exam coming up and you need to accomplish certain goals, some of that anxiety might spur you on to work a bit harder or to set some goals. So it's about how we kind of manage those symptoms. So if you're feeling anxious because of an event, it's what you then do next to help achieve the result to help resolve that problem. And that's something I'm going to be talking about in detail next week. Got another question here. I can't turn off my mind at night. How do I do that? That's a very good question. Now, if you remember me mentioning, it's one of the symptoms that cause the most frustration and anxiety. Because what we do know is if you have a lack of sleep, it can make your anxiousness worse, make your general health worse as well. So the racing thoughts occupying your mind during the day don't automatically shut off because it's time to go to bed. It doesn't work that way. So the question is, how do you slow down and calm your mind at night? So for many people with active mind, it can be very challenging to turn off your mind. And that's why you want to leave as much time before bed to try and decompress from the day. And this is one of the topics that we're going to talk about in the next video. We'll talk about kind of useful tips and kind of suggestions that you can put in place to allow you to kind of help the mind switch off. So a couple of comments here from some of our patients. What I'll try and do is try and answer them by replying to your messages after this video. So thank you for tuning in again. And again, if you find it useful and you think it'll be beneficial for your friends and family, please do like and share this so that as many people can benefit from this video as possible. So thank you again for tuning in, and I will cover the self-help measures next week, which I'm sure you'll find very helpful. Thank you.